Hey, it's Jessica DaMassa with WTF Health. I am here at the Together.Health event at HIMSS 19, and joining me right now, I have a good friend. We have Mike Biselli. He's the founder and president of Catalyst Health Tech Innovation in beautiful Denver, Colorado. Good to have you here, Mike.
Great to see you, and here we are back in Orlando for HIMSS 2019.
Oh my God, I can't believe it. So, all right, tell everybody, you're holed up in the mountains over there in Denver, basically solving all of health innovation's problems with this like mega InQ accelerator labby thing that you've built. So no, he showed me a picture of this right before this interview. This thing is massive. So talk to me about what you've got going on there, because it is huge.
Yeah, so what Catalyst is and what it is not. So Catalyst is what we call an industry integrator, bringing all aspects of healthcare under the same roof at the point of innovation to reimagine this industry together. From Fortune 100 all the way down to that woman with an idea on a napkin and everything in between. Private enterprise, government, academia, nonprofits. We're even going to have the patient involved. I know, a wild idea, right? And so what Catalyst is a 180,000 square foot brand new facility.
180,000 square feet.
And so, you know, we have 60 plus startups, like 6 different associations. Like one is an example, Medical Group Management Association. They represent 50,000 hospital administrators and through that 500,000 providers, where they get to interact with the startups and all of that. We have academic partners. We have Kaiser on the ground floor delivering care with the provider, with the patient, and the entrepreneur, right? UC Health, University of Colorado Health System, taking the entire top floor at 20,000 square feet for an innovation center that is going to be very forward-thinking. But the impetus behind all of this is because of my experience in healthcare. And what I saw through my whole journey is this massive, fundamental, and utter disconnect between the established healthcare players, the big giants that we've kind of been talking to and with throughout HIMSS, and the startups. Yep. And I said, the day that we can start singing from the same sheet of music, getting in the same boat, rowing in the same direction, those will be the moments that we start igniting a revolution for healthcare to get this nation back on the right track.
Okay, so how are you doing that there? I mean, you've got people on like multiple floors, which, I mean, but you know, sometimes, I mean, it's like, it's hard to go from floor to floor. So how are you actually pushing forward the curation of that conversation, bringing all of those players together?
Great question. It's all organic. It's all driven by our community members. Perfect example, tonight, our aging group. There's a big whole group of aging tech, right? The Silver Tsunami. They're having a meetup tonight. In a couple weeks, we're going to have a 400-person event in our 350-person event hall. So we're already oversold.
Oh my God, fire marshal.
Fire marshal alert, right? So we've already oversold that event. But we have about 20 different boardrooms and breakout rooms, a community cafe, and the building has been intentionally designed to create what I call serendipitous collisions. The moments that innovators connect and collide and start building trust, those are the moments that lead to innovation. And actually today, earlier this morning on my talk, what I mentioned as well, for people to really understand it, it's a neighborhood, right? Yeah. What did Mr. Rogers always talk about? Building neighborhood and being committed and connected to one another. And we're really lacking that in society these days. And so you can really look at Catalyst as that. It's a neighborhood of healthcare innovators, not taking no for an answer anymore, and are dedicated to moving this industry forward together.
All right, so tell me what the word on the street is in your neighborhood then. Like, what's everybody talking about? No, I like to find out, you know, I mean, you've got like, I mean, some massive intellectual capital on your, I mean, I can't even call it a campus. Like, I don't even know what to call it, but in this behemoth that you have, you've got a lot of really smart people all working on the same problems from different vantage points. So give us a little bit of insight. What's going on? What is everybody talking about?
So I'm a sociologist by training, and so this is where I get really excited. The reignition of that fire in people's bellies that brought them into this industry in the first place. Okay. Healthcare, this machine, this $3 trillion industry that touches pretty much everybody in this country. The industry and the gears and the massiveness of this industry have beat a lot of us over the head and beat us down. True. And what I've seen with Catalyst is that reignition of that fire in people's bellies that are marching in there in the morning, not taking no for an answer, and are fundamentally dedicated to moving this industry forward and knowing that we can when we work together, from the biggest players down to that woman with an idea on a napkin and everything in between.
Is there any kind of, is there anything that's emerging for you from a tech perspective that's hot right now, or anything that's not right now? I mean, especially, I guess, not even just within the tech part of it, but in terms of solutions or problems that people are going after. Like, I'd love to know, like, it's like you've got all these people, and I think in the last couple of years, we've really seen the industry shift, right? Particularly on the startup side. I mean, we used to see a lot of one-trick ponies, a lot of digital health apps that did one thing, and now we've moved more towards platforms where solutions are doing multiple things. They're addressing patient populations as opposed to addressing disease types, different things like that. So what are you seeing? I'd love to get a sense of some of the trends that you've noticed as a sociologist in your healthcare innovation universe there that you've built.
So you're spot on. We are seeing that kind of trend of platform, really taking hold. And I think it's an exciting time for the industry. A couple of the folks on campus in Denver, Helix. Right?
Yeah,
so
cool.
big genomics
Cool,
play,
yeah.
right? Their HQs in San Francisco. We've somewhat went out on their HQ2 in Denver and in Catalyst. And having the chief product officer, Chris Gloday, in there and talking to all of our different startups and all these different stakeholders to think about genomics and precision medicine and what that may or may not mean today and in the future, because it's still early, as you know. Also, what I'm seeing, two other big ecosystems that are kind of in clusters that are starting to really bubble up in Colorado. Blockchain. Okay. There's history there. The significant investment of the federal government in NORAD has spun out a bunch of technologists and engineers in cybersecurity and all of that, which is then, of course, blockchain, right? So we're starting to see that. As you know, it's still early in that space. Voice tech is another. Voice tech is another big space that I'm seeing. One great example is Sopris Health, right? A voice-enabled digital assistant and scribe for our providers, whether it be a physician or a RN or whoever that might be. But voice tech is also big, and we're seeing that growth in Colorado as well.
Okay, cool. Is there anything in terms of, you've got I love that you have really every corner of the healthcare universe covered in your space. Any kind of conversations about payment model, incentive alignment? I'd be curious to know kind of what's emerging from your perspective there in terms of incentive alignment. And typically in startups, and a couple years ago, everything was per member per month or per patient per month. Oh my God. I know, right? I feel I don't know, are we starting to move away from that? What are your thoughts?
So we still see that, right? The PMPM model. We're starting to see a lot of shared risk or at-risk models as well, which I think is important, especially as we look at our established players, right? We heard from you were interviewing some of the execs from Anthem this morning, right? When we look at these giants that are so vitally important to the ecosystem at large, how do we as innovators, how do we as startups partner with them to go at risk with them as we continue to move towards value-based care, right? So we're starting to see some of those machinations. We're starting to see that kind of bubble up in the community. So I'm excited about that. I'm really excited about self-insured employment groups and all of that, and taking that risk on. So you're starting to see some of those start bubble up around the country.
Anything not in the conversation anymore that was? We talked about some things that have fallen out of vogue, like the one-trick pony digital health app, but anything else that you feel is kind of falling away in the conversation?
Yeah, it's funny. I don't know about you, but I haven't been hearing much about wearables than I have in years past. And maybe we will see that resurgence, but over the past 18 months or so, past year, I haven't been hearing the big hype around wearables like we were in the past. Again, may come back, but I don't know about you, but I haven't seen that being as in vogue as it once was.
You know what? That's usually when I ask that question, that's the answer that I get.
Yeah.
I think it may just be because it's more ubiquitous, and I think it's it's integrated into Apple Watches now, so it's a different way. Whereas before, it was oh my God, this device tracks this.
But that goes to your point. We're getting away from that one-trick pony, right? Now we're watching these platform plays. So
yeah, I think that market's matured. But awesome. I'm glad that you're on the same page. It's always good to check these things out, Mike.
Absolutely.
All right, so we are here at Together.Health, and I want to just get your last perspective. It's cool because it's I'm beginning to see this as talking to somebody like yourself who's got this conversation that you're curating with multiple players in the ecosystem, and then now we're lifting up, and Together.Health is bringing together all of these different ecosystems like yours from around the country, adding in the payers, adding in the consumer health companies, the tech companies, the government, everything. So do you really? We've kind of been sold this idea of we just need to all talk about it in the same room and then we'll fix it. And do you think this is going to be a different foray into that kind of conversation than we've had in the past, or maybe the industry is more ready for it?
I think it's the latter. Okay. I think we've had those conversations, those feel-good conversations for years,
and then we leave,
and then nothing happens.
Right.
But you're starting to see it shift, right? And I think we're going to see it shift in big ways, and it's going to get faster. And I think what people are realizing around this nation with leaders like you and others, and we keep hearing these kind of things, we just heard from Ross Su as well now at HIMSS Health, is working together and truly dedicating ourselves, meaningful work together. This industry is so enormous, we have to. What are they doing at Cambia Grove in Seattle that we can learn from in Denver? What are we doing in Denver that our friends in Boston and then Austin, right? And as we start connecting those ecosystems around the nation, look out.
Totally. You should watch some WTF Health interviews because I've talked to all of those people and I know exactly what's going on in all of those places.
Exactly.
So you should all sit there and group binge watch me.
And now you know why I like to hang out with you.
Well, there you go. All right, Mike, thanks so much for sharing your perspective. It's always so great to hear from you. And I really appreciate, as kind of a health innovation sociologist, you really are that. It's good to hear what's happening and get like kind of an analyst perspective on the trends and what makes sense moving forward.
And thank you so much for you being out on the front lines and telling everybody stories, because that is incredibly important. People got to understand what's happening out there because this industry touches every single one of us. So keep up the great work. We love what you're doing and keep telling our story. We need it more than ever.
Thanks so much, Mike. Thanks so much. I'm Jessica DaMassa with WTF Health, glowing from the praise from Mike Biselli. Thanks so much for watching.